Hey there, how's it going? So I'm in my vehicle driving along here. Just got done with my first post-op appointment, and everything went well. Actually, tomorrow is my 1 month post-op anniversary day, and the way things stand right now, since surgery, I've dropped 32 pounds, um, and overall, since the pre-op diet started on July 2nd, I've dropped 40 pounds. So it's moving along and pretty cool. Um, Starting to notice some changes in my face. The way clothes are fitting, definitely looser, and just feeling a lot better overall. There have been some afternoons where little low energy. I attribute that probably to not having quite a regular diet. I've been on purees the last 2 weeks, gonna start soft foods tomorrow. And I think as I start incorporating more foods, a few more carbs, not heavy starches, but complex carbs, more vegetables, things like that. I'm thinking that my energy level is going to go up a little bit more. At least most days it's not bad, but I think it'll be getting a lot better. It's going really well. Everything with the surgery. So I met with a dietitian and physical therapist and surgeon today. Dietitian said everything was going great. I've been logging all of my meals. I use an app called Baritastic. Log everything that I eat and drink. It's actually pretty simple. Baritastic makes it really super simple. You can scan barcodes, or you can just enter in individual things that you've eaten. Really easy to track water and other liquids, so that's a really good one. I use an app called Happy Scale to track my weight. I also track it on Baritastic. And physical therapist good. And really the only thing physically that's been kind of an issue has been an area in my back, kind of between my spine and shoulder blades, that are really tight. Physical therapist said apparently when you start losing fat around the middle, you have a tendency to start kind of creeping over, bending over and curving the back a little bit, because there's not as much blocking the way down there, and there has been a change down there for sure. So she recommended a lower back support to kind of naturally curve the back into more of an upright position. And so I think I have something like that at home, where you could roll up a towel, that kind of thing, to put it down there, kind of lumbar support essentially. So I'll probably be doing that and seeing if that'll help that upper area. I'm walking 2 miles a day at least during the weekdays. On the weekends, I'm stretching that out to 3 to about 5 miles on the weekends, and that's going really well. Blood pressure's right on the mark, blood glucose right on the mark. It's really good. I can't say I'm very happy. I'm looking forward to kind of incorporating more foods in. Right now, as far as eating goes, I'm eating about 800 to 1,000 calories a day. That's going to increase over time. Obviously, it kind of has to, or else just kind of disappear. But I'm in the normal range for this point after surgery. And so that's all going really well. And I can't explain the feeling of getting off those medications, the diabetic medications, having normal blood glucose, getting off some of the hypertensive, the high blood pressure medications feels really good. My skin is like totally clearing up. I had a condition called sebaceous hyperplasia, which are overactive oil glands, and a lot of that probably exacerbated by the crap I was eating prior to surgery, higher fatty foods and things like that, where I had a lot of bumps all over my face, sometimes pretty darn big, and they just kept on kind of popping out and more as I got older. I'd had them for years, initially starting with just a couple kind of on my forehead, and then showing up all over the place, almost completely gone. My skin is almost completely smooth again, and it's really cool. A lot less oily, a lot clearer. My color's a lot better. And obviously this ties in with the food I'm eating since surgery, being low fat, pretty high protein, no starches, no rice, bread, or pasta. I really think a lot of that has to do with it. Very, very limited dairy product at all. I generally use oat milk instead of dairy milk if I need it for smoothies, shakes, or whatever. And I continue to plan on eating that way. Everything is just going great. So 1 month is good to go, and putting that one in the books and moving forward. My next medical checkups will be in 2 more months. That'll be in October. I'll meet again with nurse practitioner. We'll get checked vitamin levels and dietitian and some other blood tests. Meet with the dietitian, physical therapist again. Won't meet the surgeon until like a year, and it's going great. And I know a lot of people, it's varying. I'm a part of a few bariatric forums, and some people have a really tough time after surgery getting their water in. They have nausea, vomiting. I didn't experience, I had a couple instances of nausea, no vomiting. I had some GI issues, diarrhea here and there, off and on. Surgeon thinks that'll probably resolve as I move into more, adding more food to my diet than I was. But really, it's been pretty smooth sailing. And I encourage anyone who's thinking about this surgery to get as much information as you can about it. Do a lot of research, talk to your doctor, go to a clinic, get information, make sure the clinic you're considering has a really good support program. The Legacy Weight Loss and Diabetes Institute that I've used has been incredibly supportive. They're located in Portland, downtown, in the Good Samaritan Hospital complex. They've been very supportive. Can always reach out to them via email, phone call, make an appointment, talk to the dietitian, talk to the physical therapist, and so highly recommended. They have been great so far from day one. And I'm going to continue kind of the straight and narrow. Eating the right things, eating very slowly, chewing my food really well, monitoring my drink and my calories and protein every day, and just continue what I'm doing. And I think things hopefully will continue to go in a great direction until I reach my goal of being under 20% body fat. And I'm not that concerned about my weight. I don't have a really strict goal weight per se. I have a fairly sort of husky body style. and I'm not gonna get, the BMI is not only, BMI means nothing. It is such a worthless tool. It's based on white middle-aged men, and there's so many other body styles and factors and genetics that go into being healthy, and I just don't even look at BMI, even though insurance companies still look at it, which is stupid. So I'm looking at my body fat percentage more than I am weight. Obviously the weight, most of that is going to be body fat. I'm going to start incorporating resistance exercise. I was on a weight limit of 15 pounds. That's been lifted, so there's no restrictions that way. I can start working in resistance exercise, keep my body mass up, keep that metabolism going to burn that body fat. At the 3-month mark, they'll do a body composition measurement to see where my muscle mass, body fat, and all of that is compared to when my pre-surgery measurements were. So here in the future, I'll be sharing some of a little bit more about what I'm eating, how I prepare my meals for the day, how I stay on track. I think that's really important. Post-surgery is all about building habits. You have to build habits. I had so many bad habits prior to surgery. Obviously those bad habits got me overweight and changed what level my body was, that body fat percentage that my body started defending, and made it so hard to lose weight. That all changes after surgery, and you have to build habits support that change. And it's not easy, because if you were kind of a snacker throughout the day, you kind of have that feeling that, hey, I should be eating, and getting to recognize satiety and knowing that you don't have to eat until you're stuffed and you'll feel just fine. All those things are new again. They're natural to people who are thin, and very new sort of feelings to get through right now. And that's what I'm going through, is really trying to build these new habits and new feelings. And I think that's going to be a battle for a while. Right now I'm winning that battle. I plan to keep up the good fight and make sure that those habits get really ingrained, and keep a picture of my unhealthy self in my mind when I'm tempted by old habits, and try not to stray from that. And that's where things are right now. I mean, comment down below, ask questions, please subscribe for future updates. I plan on keeping this channel going for as long as I can, no matter how many viewers and subscribers I get. I'm not in this to be a YouTuber by trade or living or anything. I doubt I'll ever have enough subscribers for that. But I'm going to keep logging this. It's really kind of for me to look back on and see where I was and not go back there again. So, but I would enjoy, if I can help one person, inspire one person, I'll be happy about it. And that's all for right now. I'll probably put out another one before the weekend, maybe a little more food oriented, talk about eating, maybe a top 10 list or something like that. Those seem to be pretty popular out there. So until next time, we'll see you, and thanks for watching, and take care of yourself.